When it comes to Medicaid, food assistance, and poverty, you've talked about protecting Medicaid and food assistance, but I want to push that a little further. Would you support expanding Medicaid, food assistance, disability support, and the other safety nets programs?
For sure. The fact that Kansas never expanded access to Medicaid as one of a very small minority of states is literally immoral. And so certainly changing the leadership at the state level will hopefully change that dynamic. That being said, the cuts that came to Medicaid, i.e., saying that if you're not actively employed, you can't, like suggesting that Medicaid is some sort of privilege or that healthcare access is some sort of privilege that you have to earn. Again, I'll go back to use the word immoral. I don't think that's too strong. So it would absolutely expand Medicaid access and candidly what Medicaid covers. We have plenty of folks on these various Medicaid programs that still are, it improves their health, their livelihood and their health, but it doesn't solve it. And so Medicaid is not a perfect program. I have much more experience with Medicaid than I do Medicare just because of the patient I take care of. But I'm still making peer-to-peer calls for Medicaid to get my patients the services that they demand, that they need. And so expanding Medicaid, but also having Medicaid cover more services, I think is important.
My grandson is level 3 autistic and he has really good insurance, but because of that, the different groups we're in, there are a lot of parents that have Medicaid, and the amount of services they're willing to give them are so limited that they're like, we really think they should be here 4 times a week in speech therapy, but Medicaid only pays for 2.
In my world, as my niche now, elective surgery wise, is sports. And so an example of that is I'll do an ACL reconstruction on a patient who would probably benefit from at least 20 to 30 post-op therapy visits. And some of the Kansas Medicaid programs will allow 6. And so you could argue we're doing more harm than good by doing a surgery and then not having adequate therapy afterwards. Fortunately, the institution I work for understands and respects that and will still deliver the service, but that's a huge burden on the institution.